name's Jason Putz. I'm a physical therapist at Physical Therapy Solutions in Dyersville, Iowa and Manchester, Iowa. Today we're going to talk about ergonomics at the workstation and give you some good cues for setting yourself up properly for when you're sitting at your workstation. Computer-wise, it's probably best when you're sitting that your chair is at a spot where your knee is at a 90-degree angle or like an L, and then from your leg here to your upper body is an L as well. So it's two 90-degree angles here and there. So we don't want to be way down low, and we don't want to have ourselves up so high that we're leaning forward. Seat pan, so some of the chair seat pans will actually come forward or go back, and you want to have about your forefingers to be able to get behind the back of your knee so you don't have the seat pan for people that have short legs digging into the back of their knee. If you have armrests, they should just below elbow height, so when you rest that they're resting there and they're not holding you up, and that they're not too low and feel like you're dropped down. When you're at a sitting desk like we are here, getting underneath and trying to have the desk level again just at about elbow height or slightly below. So we have a desk that can kind of raise up and down and adjust for us for people that are of different heights. So having that again level or slightly down. The wrist pads are nice to be able to key, and then when you're looking out at your monitor, the first line that you read should be level with your eyes. So if I have, this is where you're going to have to change things around a little bit, where our computer screen can raise up and down based off this. But again, the first line that you read, you should be able to be level with your eyes. If you do have bifocals, that should be down about 2 inches from level, okay? And the things that you use most should be the closest to you. So if I'm using my mouse, I want to have my elbow down by my side and being able to use the mouse out here. I do not want to have the mouse out here where I'm having to reach a lot. If I use my 9 keypad, again, I want to try to bring that close to me and use that often in here. Things that you do not use very often, if you're a person that works at the desk, that you might take an occasional phone call, then it's fine to have your phone far away. If it's something that you're on the phone a lot, I would say use a headset and have that phone close to you. If you're on the phone a lot and you have to key, having a headset is pretty important and crucial, so you're not feeling like you're holding or trying to do things one-handed. That would put you in awkward positions. So again, we do have a sit-to-stand desk here, and so we're going to raise it up and talk about basically very similar things. If Barb wants to scan at the floor, we have a mat that is ergonomically friendly, and it allows for cushioning for us standing. You can see where the chair was digging in there a little bit, but this gives our people good cushioning and shock absorption that we need. Again, with our standing desk, we still want to have the keyboard right at that level or slightly below with our elbows, and our screen should be looking, the first line that we're reading is level with our eyes. So no matter if you're sitting or standing, that's kind of what we want you to do. Again, in the standing position, I don't want you locking your knees out backwards. It's important that your knees have a slight bend to them. So I'm not expecting people to stand here squatting, but they just don't have their knees locked. And especially kind of going to one where they lock out one knee or they lock out the other knee, that ends up putting a lot of pressure on your hip and your low back. And so trying to just stand with knees basically unlocked, performing your daily task. I hope this was helpful for everybody. If you have any questions, feel free to give us a call. In Manchester, it's 563-927-1499, and in Dyersville, it's 563-875-8615. You can always like us on Facebook and find us on the web at www.ptsiowa.com. Thank you.